Healthcare in England is provided by the National Health Service, known as NHS, and provides treatment for all residents through a wide range of healthcare services. Healthcare is provided by the British government and is paid for through taxes. As you will see later, most services are free, but some are paid for at NHS rates. When you move to England, you will qualify for NHS treatment from the day you arrive, as long as you intend and are entitled to live here permanently. As a rule of thumb, this typically means you will be here for at least 6 months and your passport allows you to stay here for at least 1 year without any restrictions. This also applies to family living with you permanently, such as your partner, children under 16, or children under 19 if studying full-time. Registering with the NHS is easy. You will be given your NHS number when you register with a GP practice. Simply visit a GP practice near your home and complete and submit their forms. You will need proof of identity such as your passport and a proof of address like a recent utility bill. You will then receive your NHS medical card and number by post. You can change your GP practice at any time. Simply repeat the first 2 steps at the GP practice you would like to join, and if you're accepted, your medical records will automatically be transferred to your new practice. In some cases, you may be unable to register with a GP practice. This may happen if you are not eligible to receive healthcare in England, the practice is not accepting new patients, or you live outside the area covered by the practice. This is because most GPs are quite strict about their practice boundary. However, some GP practices now participate in a patient choice scheme, which gives you the right to register somewhere more convenient for you. This means even though you live here, some practices allow you to register somewhere near your workplace. When receiving care from the NHS, it's important to know that your first point of contact is a primary care provider. This means day-to-day providers such as general practitioners, dentists, and ophthalmic practitioners are always your first point of contact for non-urgent healthcare. Primary care providers refer you to secondary care providers who are made up of specialists. If you need to see a specialist, you will need to see your GP, dentist, or ophthalmic practitioner first, and only they will decide if you need to see a specialist in a particular field, such as a surgeon, dermatologist, or cardiologist. A specialist will only see you with a referral letter, so your doctor will write a patient referral letter on your behalf, which will include your medical history and background. In England, you have the right to start treatment with a specialist within 18 weeks from when your GP, dentist, or other healthcare professional refers you. The right to treatment within 18 weeks from referral excludes maternity services and some mental health services. The NHS provides a range of services which include GP services, hospital services, emergency care, known as accident and emergency or A&E, mental health, sexual health, and social care, all of which are completely free. The NHS also provides dental services, eye care, and prescriptions in pharmacy which are paid for services based on costs and band charges set by the NHS. A number of people are entitled to free prescriptions, dental treatments, and eye tests depending on eligibility. You can find out if you qualify for free services on the NHS website. For urgent assistance, the official emergency telephone number in the UK is 999, which is equivalent to 911 in some other countries. When you need urgent care, there are a number of NHS services you can use other than hospitals and A&E departments. The first are NHS walk-in centres, which are convenient as they do not require an appointment and most are open every day of the year and outside office hours. They do not deal with long-term or emergency life-threatening conditions. GP and dentist out of hours is available outside normal practice hours, normally from 6:30 p.m. to 8 a.m. on weekdays and all day on weekends and bank holidays. You will usually be directed to the out-of-hours service when you call in. Minor injuries units offer assessment and treatment for minor injuries such as sprains and strains. And lastly, NHS 111 offer free telephone support when you need medical help fast, but it's not a 999 emergency. NHS 111 is available 24 hours a day, 365 days a year. The Care Quality Commission are an independent regulator who inspect the level of safety and quality of all health and social care providers. You can find all of their inspection reports online.